Hey guys, welcome to the third episode of The Breakdown. So, in this week's episode, I'm going to focus on something that really helped me, and it's taking everything from the stem and giving myself a one liner for what the question is truly asking. I know sometimes I'll do a question and it just seems like there's so much information, or maybe we've over highlighted, or we just haven't highlighted enough even. And I just can't figure out what the STEM is actually asking me. So this is something I've worked on a lot, and I'm going to kind of show you guys, my method to this. So let's get started. So like I keep saying, I always read the last sentence first. So I'm looking for a drug and its immediate effect. So I know I said in the very first video, sometimes if I have a farm question, the first thing that I'm doing is I'm looking to see if they gave me the drug in the next sentence. So a physician tries medication associated with an increased risk of bronchospasm. So maybe some type of beta agonist here. So let's just read because I'm not 100% sure. Okay. So right here, I have a older woman, 55-year-old woman, when she has involuntary hand movements that improve with alcohol. So right here, this is a pathognomonic for an essential tremor. Essential tremors get better with alcohol use. So I actually don't even need to read this. We can right here. So bilateral hand tremors, they worsen with the patient, worsen when the patient is asked to extend her hands out in front of her. This is another thing that happens with an essential tremor. When you ask them to extend the hands, they actually start to shake more. But improved with alcohol, a tremor that's improved with alcohol, that's for sure an essential tremor. And the number one treatment for that is propranolol. So if we were to summarize this whole stem into one sentence, it's what is an immediate effect of propranolol? So let me say that one more time. This whole stem is asking me, what is an immediate effect of propranolol? So we have a nonspecific beta agonist. Beta antagonist, sorry. So the first thing that I'm going to do is I'm going to get rid of heart rate because this is the easiest for me. So if I have a beta antagonist, I'm going to have decreased heart rate, right? Because if I have, say, beta 1 like dobutamine, that gives me an increased heart rate. So beta 1 is for the heart. So if I have propranolol, nonspecific beta 1 antagonist, so I get a decreased heart rate. I will also get a decrease in stroke volume because remember, stroke volume is cardiac output times heart rate. So if I decrease the heart rate, I should also get a decrease in stroke volume. So B and C, those don't really narrow it down for us. So we're left with PVR, so our peripheral vascular resistance. So anytime you get a decrease in heart rate, we should get a reflexive increase in our peripheral vascular resistance to compensate for the decreased heart rate. So we should be left with D. Nice. So again, we read this stem. It's telling us we have, a woman, she has some kind of hand tremor that improves with alcohol. Now that tells us she has an essential tremor. They gave her a drug, and what is the immediate effect of this? So what is the drug that they used for the essential tremor, propranolol? So what is an immediate effect now of our propranolol? That's the whole stem in one sentence. What is the immediate effect that propranolol, a non-specific beta antagonist, will give us? All right, 2. So compared to treatment with propranolol, this again, which of the following adverse effects is most likely? So again, here's another farm question. So I'm looking for the drug that they're comparing it to. So they gave this person carvedilol, and I want to compare that to propranolol. So we just said propranolol is a non-specific beta antagonist. So beta 1, beta 2 antagonist. Carvedilol is a non-specific beta antagonist, but it also has alpha function. So it's also an alpha 1 inhibitor. So that has to be our difference maker. So what is an adverse effect from blocking alpha 1? We said this was beta. We just said that from question 1. We know that these are beta. This is also beta. This too. So alpha 1, remember, anytime you have an alpha 1 agonist, you're thinking vasoconstriction of just about everything. So if you do the opposite of that, we should have vasodilation. We should get hypotension. So if we were to sum this one question up in our one sentence, it would have been, what is an effect of alpha 1 antagonism? So if we antagonize alpha 1, we should get vasodilation, gives us our hypertension. So that was our one-liner. What is an effect of alpha 1 blocking? 3. So we're looking for an age-related change in respiratory function. So 74-year-old woman has a history of hypertension that's well controlled. Oh, she's only using diet and exercise, so that's really not super important to us. She has no drug use. She walks a mile a day. Pulse is normal. Respiration is normal. BP is normal. No abnormalities on physical exam. So essentially, this, our one-liner for this is, what is a normal age-related change in our functional respiratory capacity? So this is something that you can conceptualize. So as you get older, we lose our elastic fibers. And remember, elastin is what helps us do our elastic recoil. So that helps, if our alveoli are like this, the recoil helps us kind of, we fill, and our recoil brings us back to normal state. We fill, we come back to normal state. So compliance is volume over pressure. So if you lose your elastic recoil and you can't come back to normal here, you just tend to keep increasing your volume. So over time, as we age, we get a normal kind of steady increase in lung compliance. One thing you'll learn too, that your total lung capacity stays the same as we age. So it's pretty much unchanged. And that's always kind of where I start. And then let's see what they say here. Yeah, I always just remember those elastic fibers, because as we age, things tend to break down, they get old, we lose that recoil, and then we're kind of stuck with our puffed up alveoli, which increases our compliance, because compliance is volume over pressure. So more volume means more compliance. So. And that's a wrap for our third week of the Amboss breakdown. I know today was kind of short, but the biggest take from this episode is that, you read a stem, and before you do anything, really try and focus on, what is this actually asking me? Get it to one sentence of what is the true question here. Not, oh, this patient has this, and this, and, where am I going? Just try and break it down to the simplest form of, what is an alpha 1 beta, what is an adverse effect of alpha 1 blocking? What is an effect of propranolol? What is a normal age-related change in respiratory function? Those are just single liners that we can break down these long stems into and kind of get to our answer in a simpler way. So hopefully that was helpful. I am going to do an episode hopefully next week, and I promise it won't be 2 weeks late. So thank you.